Securing your family's future with Metro IVF in Lite FM Snapshot.
I'm speaking with Dr. Swi Peng, a fertility consultant at Metro IVF. If a couple decides to seek fertility treatments, what kind of treatments are currently available to them?
The treatment available are medication, IUI, intrauterine insemination, IVF, in vitro fertilization, or surgery. Medication can be oral or injection, and both of them will act directly at the ovary to stimulate the ovary to produce more and better eggs. It is good for those women who have irregular menses and who do not ovulate, and 80% will have results, and half of them will get pregnant after 6 months. Better results can be obtained if this medication is combined with IUI, intrauterine insemination.
Metro IVF, empowering you with fertility knowledge and Lite FM Snapshot. Securing your family's future with Metro IVF in Lite FM Snapshot.
I'm speaking with Dr. Swi Peng, a fertility consultant at Metro IVF. Does it make sense for the couple to choose the treatments that have high chance of getting pregnant, like IVF, and skip the others, for example, medication or IUI?
IVF require higher costs. In Malaysia, cost is the biggest barrier for a couple to do IVF. Based on the average household income, it will require 60% of her annual income to do one cycle of IVF. Compared with other countries like Australia, it's only 6%. The other reason is most of the studies have shown that 50% of couples will get pregnant using simple advice and treatment. Example, if a woman with irregular menses and not ovulating, then if she were to use medication, she will have a 50% chance of getting pregnant within 6 months.
Metro IVF, empowering you with fertility knowledge and Lite FM Snapshot. Securing your family's future with Metro IVF in Lite FM Snapshot.
I'm speaking with Dr. Swi Peng, a fertility consultant at Metro IVF. If one treatment cycle does not succeed, how long does the couple need to wait in order to do the next cycle?
As soon as possible. If she has recovered from the physical and emotional stress of the previous cycle. Previously, the trend was to wait a few months between IVF cycle, because it was believed that the drug use and the needle puncture to aspirate the egg would cause less eggs to be produced in the next cycle. Current research shows that the number of eggs retrieved in the next cycle is about the same. Another reason to continue the next cycle as soon as possible is because the longer you wait, the quality of the eggs will go down and the chance of getting pregnant becomes lower.
Metro IVF, empowering you with fertility knowledge and Lite FM Snapshot. Securing your family's future with Metro IVF in Lite FM Snapshot.
I'm speaking with Dr. Swi Peng, a fertility consultant at Metro IVF. The success rate of IVF treatment is not 100%, so are there ways to improve the chances of pregnancy for patients with repeated failed IVF?
One is ICSI. During ICSI, the embryologist will select the best sperm and inject the sperm into the egg directly. This will increase fertilization rate. Second is to use assisted hatching. Just before the embryo is transferred into the uterine cavity, the embryologist will use laser to make small hole in the capsule. This hole will allow the embryo to hatch and implant on the uterine lining. Third is to do endometrial scratching 1 week before the start of the next cycle. This scratching will activate the uterine lining and make it more fertile for the embryo to implant.
Metro IVF, empowering you with fertility knowledge and Lite FM Snapshot. Securing your family's future with Metro IVF in Lite FM Snapshot.
I'm speaking with Dr. Swi Peng, a fertility consultant at Metro IVF. For patients with blocked tubes, is it better to have surgery to unblock the tube to do IVF?
In the past, surgery was the only option for women with blocked tube. The surgery will unblock it in 70% of the cases, and half of these will later achieve pregnancy. The other half will still remain infertile because of the scarring. So basically, 35% of those who do surgery will successfully get pregnant. Today, IVF is a better choice. Pregnancy is higher, about double, and there's no hospital stay. The cost is about the same. Another advantage of IVF is that other fertility causes like poor sperm, endometriosis, the IVF will at the same time overcome the problem.
Metro IVF, empowering you with fertility knowledge and Lite FM Snapshot.